Today I'm going to talk you through one of the most trending health topic, which is vitamin D deficiency. So first of all, what is vitamin D? Vitamin D is an essential vitamin for bodily functions and well-being. So how do we get vitamin D? You might be surprised to hear that we can synthesize vitamin D from sunlight. Therefore, it is also known as sunshine vitamin. Now, when sunlight falls on our skin, it can synthesize vitamin D through multiple steps. And also we can get vitamin D from diet, especially things like salmon and sardine, egg yolk, liver, mushroom, and fortified products can give us vitamin D. The vitamin D we acquire in different methods will be stored in the liver, in the vitamin D stores. Now, when you need to use vitamin D, it needs to be activated in the kidney. So in other words, your skin, liver, and kidney are essential organs for a good level of vitamin D. Now, vitamin D is essential for stronger bones, thicker bones, as well as good muscle functions. Now, these are known as musculoskeletal benefits. And over the past years, we have realized vitamin D is actually beyond the bones and the muscles. So, they have other benefits beyond the muscles and the bones. We know vitamin D is essential for stronger immunity. If you can recall, during the times of COVID, vitamin D came into picture. So vitamin D is also essential to keep your immune system under check so that you won't develop autoimmune diseases. For example, neurological diseases like multiple sclerosis, there are researches and studies to say whether they are related to vitamin D deficiency. These are under research level, but there have been positive trends in modulating immune system by vitamin D. And also, vitamin D is essential for our cardiac health, sometimes to prevent cancer and cancer spread, and also it's quite essential for our mood, as well as when there is vitamin D deficiency, some people end up with depressive symptoms. So you can see, in addition to controlling or managing the bones and the muscles, vitamin D does a lot of other functions. So as you can assume, vitamin D deficiency can cause your bones to become fragile, so you can fracture easily, and also your muscles become achy, as well as you can have weakness of your muscles. Also, due to the poor immunity, sometimes it can push you to develop recurrent infections. You might feel extreme fatigue if you are vitamin D deficient. Sometimes we see people coming and telling they are always fatigued, and when we check vitamin D level, we notice that they are deficient of vitamin D. And also, as we discussed, it can push you to bad heart health, as well as sometimes even the risk of cancer can be increased. So vitamin D deficiency can also cause your mood to go down and cause things like depression, as well as in females. Sometimes we see vitamin D deficiency can be associated with subfertility as well as pregnancy losses. Now these are still under the research is being done, but there have been a positive trend towards worse outcomes when you are vitamin D deficient. As we grow older, we know our risk of vitamin D deficiency increase. So people who are more than 65 to 70 years of age are at increased risk. Similarly, vitamin D is acquired through sunlight. Therefore, as a part of your culture or occupation, if you cover most of your body, as well as homebound people like bedridden people, they have increased risk of vitamin D deficiency. Also, if your diet is not nutritive enough, if you have malabsorptions like celiac disease or Crohn's disease, in other words, bowel diseases, which blocks vitamin D from absorption, then you might have a higher risk than others. Also, bariatric surgery, that is a weight reduction surgery, sometimes push you to vitamin D deficiency, so you should be on supplements. And finally, if you are on certain medications like antiepileptics like carbamazepine, they might increase the use of vitamin D. Therefore, it might also increase your risk of vitamin D deficiency. Now, we spoke about what is vitamin D, its symptoms, as well as who are at risk. So how do we diagnose this condition? The good news is you can quite conveniently diagnose vitamin D deficiency with a simple blood test. And there are no special preparations for this test, and it's a matter of giving the blood. Once the blood results are available, depending on the value, your doctor will decide whether you are vitamin D sufficient, in which case you are all right, or whether you are vitamin D deficient. Now, if your doctor thinks you are vitamin D deficient, then of course you need vitamin D replacement. So if your doctor thinks you are vitamin D deficient and your lab result shows the same, you will be put on vitamin D replacement. But you have to always remember, we encourage you to go out and do physical activity, especially in sunlight, which is quite abundantly available in Sri Lanka. So you can get whatever the share you can get through the sunshine as well as food. Now, vitamin D replacement depends on how much you are deficient of vitamin D. If you are a borderline deficient patient, your doctor will put you on a relatively milder dose to be taken daily. But if you are severely deficient, your doctor might take you through something called the loading phase, where you will be initially put on a weekly dose, quite a large dose, to be taken for about 8 to 12 weeks. And then subsequently he will check your vitamin D level and then come down on the dose. And now vitamin D is a fat-soluble vitamin, so it is not without harms because it can retain in your body. So you should not take large amount of vitamin D without medical supervision, because if it retains too much, if you have become excess of vitamin D, that also can cause fractures, make your muscles weaker, and sometimes you might encounter troubles with high calcium. So vitamin D deficiency is quite a common condition, and it can be readily diagnosed and treated efficiently with current medications.